here on Marketplace is Dr. Craig Bax from the Center for Prevention, Cure Chronic Disease. Thanks so much for joining us.
Thank you for having me this morning.
All right, so today we're here to talk about why it's never too early or too late when it comes to preventative care. And we've talked about this a lot and how helpful it is in terms of reducing your risk for chronic disease. So let's go ahead and talk first why some people who seem healthy or at lower risk for chronic disease end up having significant life events such as heart attacks or strokes.
Well, it's a great question. The problem that we have with our mainstream approach to the problem of heart attack, stroke, diabetes, prediabetes, and dementia is that we take an approach that says you're innocent until proven guilty. If you don't have obvious signs or symptoms, the way to approach it is to react to those signs and symptoms. Events are a result of the presence of a disease that's been going on for quite some time. And unless we go digging and looking for it, we won't find it. And if we find it, then we can reverse it, and that's not widely appreciated. The things that are typically identified do a pretty good job, but we can do better. If we look for issues like genetic predisposition, including those that can be modified by diet specific to that person, or certain medications specific to that person, we often overlook with our mainstream approach the presence of prediabetes and insulin resistance, which precedes the onset of diabetes by years, and we can find it now and reverse it.
So let's talk about that. What are some of the risk factors that you believe are missed that contribute to chronic disease?
The most prevalent one is the one I just mentioned, that is insulin resistance, which leads to prediabetes and then to diabetes. Even before somebody has a diagnosis of diabetes based on their blood sugar, they have a problem. They are insulin resistant, and we can detect that with blood testing, but even more conveniently with body composition analysis by identifying the presence of high levels of visceral fat. There are a lot of other things like specific lipids that are not tested for. Lipoprotein A is a good example. It's not part of the routine testing, but it really should be because it affects about 20% of the population. And then you get into the issue of periodontal disease. The dentists and the hygienists can play a huge role in reducing the burden of our atherosclerosis and prediabetes and diabetes if they're just tuned into it beyond their usual work.
Okay, now if someone were to have a heart attack or a stroke, or they're seeing these symptoms of chronic disease, what can they do to help reverse that?
Well, we assume that if you've had a heart attack or a stroke that you probably don't want to have another one. You might not be so lucky this time, plus just the experience is life-changing even if you survive. So going through a more complete assessment to identify what was missed. Maybe it was known but it wasn't fully addressed, or maybe it wasn't known and if you don't know it you can't address it. So we offer that opportunity for even those who are quite old and who have already gone through these life-altering events. There's always an opportunity to do better. And even if for the older patient who feels that they have done well, survived they've gotten into their 80s, preservation of brain function is a big issue. The problems with vascular dementia and even Alzheimer's disease can be averted by the same approach that prevents heart attacks, strokes, and diabetes.
Okay, so for those that are looking for more information, if they have experienced one of these life-altering events, such as a heart attack or a stroke, and they're wanting to avoid further events, they're in that recovery process, where can they go to reach you for more information?
Our website is thecenterforprevention.com, or you can just call our office at 217-321-1987, and we'll do our best to help you.
All right, thank you so much, Dr. Bax, for joining us here on Marketplace. We'll be right back right after this quick break.